your student nurse today.
Okay.
How are you doing today?
Good.
All right, so I'm going to provide for privacy, assess the scene for safety. There is no noticeable tripping hazards, no spills or electrical issues. We are currently in a safe environment. I performed hand hygiene using my hand sanitizer. Can you tell me your name and date of birth, please?
Keziah Mandregan, February 16th, 1990.
Great. Can you tell me why you're here today?
Just for a physical exam.
Okay. Do you know where we are?
Fairbanks, Alaska.
And can you tell me who our current president is?
Donald Trump.
Great, great. So, do you have any concerns you want to bring up to the doctor today?
No.
Okay. Well, first thing is I'm going to explain, we're going to do a head-to-toe assessment. I'm going to be inspecting and palpating, which means I'm going to just be looking at different things from your head to your toe and touching areas, making sure there's no nodules, masses, tenderness, lesions, anything to worry about. And I will also be testing your range of motion and muscle strength, some reflexes, and cranial nerves. Does that sound okay?
Yeah.
All right. So I have some questions that I gotta ask everybody. Do you have any current medical issues?
No.
Okay. Any allergies?
To cats, horses, apples, pitted fruit.
Okay. And what do you do for your allergies? What kind of reactions do you have?
Well, I try to just avoid those things, and but it makes my horses makes my throat close, and my whole body will swell up, even my face really big, and so then I would go to the hospital, and but for like apples and stuff, if I accidentally have it in like a fruit salad, then I just take Benadryl and it clears it right up. It just It gives me a real itchy throat.
Okay. Do you know what kind of Benadryl you usually take?
Yeah, it's like instant relief kind that my sister has in her cupboard.
Okay. Is it a gel cap or a tablet?
It's a gel cap.
All right. And is it the typical 25 milligram dose, or do you take more than that?
I think it's just 25 milligrams.
Okay. All right. Any drug allergies?
No.
No? Okay, that's good. Can you tell me about any past medical history, including hospitalizations or surgeries?
Yeah, when I was really little, like 6 years old, I had my tonsils removed. And then when I was in high school, I had surgery on my right foot. I broke it a couple times, and then the last time they put a pin in it. And then I got in a rock fight when I was little, and I lost. And I've had surgery on my lip twice, and I had a baby in 2018, a girl.
Well, congratulations.
Thank you.
And did you have to stay a while in the hospital? Any complications or?
No complications, no tearing. It was just a regular birth, and then they made me wait around a couple days until the baby had a wet diaper.
All right.
So, yeah.
Okay. So you've had surgeries. Do you know if you are up to date on your immunizations? Do you need an influenza vaccine or pneumovac?
No, I think I had one of those recently, this fall at least.
Okay.
That's soon enough, right?
And have you had the tetanus, diphtheria, pertussis, MMR, and stuff like that?
I know in 2018 I had all my shots because they made sure when I was pregnant. So,
okay.
I should be up to date on them.
Great. And we can always check your chart and see if we need to give you any additional vaccines.
Okay.
How do you currently work?
Yeah. I work at the courthouse downtown,
Okay.
the Rabinowitz courthouse, as an in-court judicial assistant.
Okay. Do you feel safe at work?
Yeah.
Okay. And what's your home like?
It's good.
Yeah? Do you
Yeah.
feel safe at home?
Yeah.
Okay. Do you use any over-the-counter or prescription medications or any herbal supplements?
I take a prenatal, just from Costco, and then that's it.
All right. Do you know the name of it?
I think it's Open Nature.
Okay. And I will take note of that and let your doctor know. Do you have any family medical history that we need to know about or would be relevant?
No, there's type 1 diabetes on my dad's side and some asthma on my mom's side, and that's about it.
Okay. And is the asthma well controlled?
Yeah, she takes albuterol. So.
Okay. Great. Now, are you having any pain right now?
No, this chair is kind of uncomfortable, so my back is a little weird to sit up in, but that's about it.
Sorry, our normal exam chair is actually out being repaired right now, so we had to put this couch in.
It's okay.
All right. So I would state she is alert and oriented to person, place, time, and events. She knew why she was here. She is upright and erect posture. She appears fairly comfortable. No outward grimacing or, furrowed brows, facial expressions. Okay. So you said you weren't really having any pain. On a scale of 0 to 10, what would you say your pain is right now?
0.
Okay, great. So I would assess oral temperature with a thermometer. I currently don't have one. I would also assess pulse. So I'm gonna just do hand hygiene again. I would usually wear gloves to touch somebody. I'm gonna palpate your radial pulse. All right, good deal. And I got 80 for your pulse rate. Next, I would do a 2-step blood pressure cuff, though I do not have a sphygmomanometer, so I would just explain that I would apply the cuff about 1.5 inches away from the antecubital space. I would palpate for the brachial artery and inflate the cuff until the pulse is obliterated and take note of that number to estimate the systolic. Then I would deflate the cuff and wait probably 30 to 60 seconds for her blood to just flow normally again. And during that time, I was secretly counting her respiration rate, and I got 16 respirations. Then I would go ahead and take my stethoscope, and I would listen at the brachial artery with the sphygmomanometer, pump it up 30 millimeters mercury beyond what I estimated the systolic to be, and then I would slowly release the air and listen to her blood pressure. And I would take a pulse ox reading, but I don't have a pulse oximeter, so I'm going to have to defer that. And I note that her respirations, her chest rises and falls equally. Both shoulders and sides of the chest are rising and falling at a same rate. Her antero-posterior to transverse ratio is 1:2, and no labored breathing. So next I'm going to just inspect your hair and head, palpate, and kind of move down from there. Is that okay?
Yeah.
Okay, so I'm going to just palpate her head. Any tenderness?
No.
Or pain?
No.
Okay. And inspect. And there's no abrupt rounding bald areas or masses, nodules, tenderness. Her head is midline, normocephalic. She has thick, silky, and resilient hair that is the appropriate color for her ethnicity. And it is free from crusting lesions or infestations. Good deal. I'm gonna palpate. Any pain right here?
No.
Okay, so and I'm just gonna inspect in there and blind myself. Okay, so
Are they clean?
yeah, no discharge, crusting lesions, masses, or nodules on there. And I'll come check this one out. And any pain?
No.
Discomfort at all?
No.
Okay, so I note her ears are symmetric and no pain on palpation or tenderness, no masses, swelling, nodules, lesions, or discharge from the auditory canal. Now I move on and I'm going to assess her skin. And all right, brisk skin turgor. Her skin is warm, equal temperature bilaterally. Her skin color is even toned and the appropriate color for her ethnicity. It is moist and has that brisk skin turgor. I do note that there's an abrasion here and a tattoo on her left wrist. Okay. And capillary refill, 2+, full, not full, it's brisk. Okay, so her face, it is normal, or the appropriate color for her ethnicity. Her eyebrows are symmetrical with no thinning or crusting lesions, infestations. Her orbits are free from swelling. There is a little bit of mascara, looks like, coming down right here, but no allergic shiners or edema. And she's wearing mascara on upper and lower lashes and a little bit of eyeliner, but the sclera are mostly white and shiny. Cornea is clear. Can I have you pull down your lower lid? Conjunctiva is pink, and conjunctiva are pink and smooth and shiny. I'm going to palpate your face a little more. The frontal and maxillary sinuses. Can you clench your jaw? Okay, no popping, locking, or crepitus. Any problems with nasal discharge? Okay.
No.
So her nose is midline on the face. No flaring of nostrils until she just did that.
I'm sorry.
No discharge, redness, swelling, nodules, or tenderness on palpation. Her nasolabial folds and palpebral folds are symmetric. I note her lips are pink and moist. Can I have you open your mouth for me? I'm gonna inspect in here. Can you lift your tongue up? Okay, can you stick your tongue out and move it up and down and left and right? All right, cranial nerve 12 is intact. I'm going to inspect, and can you say ah?
Ah.
All right, so the uvula is midline. She's able to say ah without hoarseness, using a clear tone. Cranial nerve 10 is intact. The buccal mucosa is pink and moist, no edema, swelling, or lesions or masses. Her posterior wall is pink and moist and free from exudate. There are no tonsils noted, and that would be due to the tonsillectomy. Her teeth are white and shiny and free from any notches, wears, caries. You have nice teeth.
Thank you.
And I will move on, and I'm just going to and her upper extremity pulses are 2+, full, bounding, equal bilaterally. No, can you lean back a little bit? Look side. And to the other side. No jugular vein distension. All right. So next I'm going to listen to your heart sounds. Do you mind?
Mm-hmm.
Okay. And I'm going to auscultate heart sounds. The aortic, pulmonic, Erb's point, tricuspid, and mitral areas. So I will palpate and go auscultate the diaphragm of my stethoscope. Can I have you lift your breast for me? All right. And I'm gonna come up under here and auscultate. Going to maximal impulse. And S1 and S2 are noted in all areas, no S3 or S4. Next, I'm going to listen to your lung sounds.
Okay.
Any problems with breathing lately? Okay.
No.
So when I tap on your shoulder, can you take a deep breath in through your nose and out through your mouth?
Yeah.
All right. All right. And I'm just going to come up under your shirt. Again.
Sorry. I think I did that out of my nose. Sorry.
And I will. Alright. I'm going to listen to the sounds on the back. Okay. Again. Okay.
Oh, sorry.
All right. So I heard the vesicular, bronchial, and bronchial-vesicular noises. No adventitious breath sounds noted. So next I'm going to assess your cranial nerves, okay?
Okay.
So I will start by saying cranial nerve 1 and 2 assessment is going to be deferred due to no Snellen chart or otoscope and no problems with tasting, smelling. So first, I just am obsessively doing hand hygiene. Okay. So can I have you smile, frown, open your eyes, close your eyes, puff out your cheeks? So cranial nerve 7 is intact. While your eyes are closed, can you tell me where I'm touching?
Left cheek, right cheek, chin, forehead.
All right, cranial nerve 5 is intact. Now I'm going to move on, and I'm going to have you open your eyes back up. So I'm going to assess cranial nerves 3, 4, and 6 using the 6 cardinal fields of gaze. So I'm going to need you to look at this pen and follow it without moving your head. Yeah, that's the expected response. All right, now I'm going to come in from the side. You just look straight forward. All right. Can I have you look far off into the distance? Okay. I'm gonna let a little more light in for this one. Okay, so I'm gonna have you look back at that wall, and that will dilate your eyes. And I'll just now can you look at this? Alrighty. So cranial nerves 3, 4, and 6 are intact. She has pupils that are equal, round, reactive, and light accommodating. And extraocular eye movements are as expected. No nystagmus or strabismus, no tremors, and no signs of anisequoia. That's a good thing. Can I have you close your eyes? Okay. And I'm just going to cover your ear.
I hear that. left ear, both ears.
All right. Now, can I have you stand up?
Yeah.
Go ahead and put your arms to your side, feet together, and close your eyes. And I want time for 30 seconds. Great. Okay, have a seat. And that is negative. Robert, cranial nerve 8 is intact. Slight swaying is normal.
Okay.
All right. Now I will test your swallowing, but I'm going to defer the taste test and gag reflex. Any problems with swallowing lately?
No.
Okay, so here's some water. Go ahead and swallow. All right, so cranial nerve 9 is intact. Can you open your mouth? Say ah.
Ah.
I already did this, didn't I?
It's okay.
Sorry about that. Uvula is midline. She's able to state that with no hoarseness, and she has a clear tone. And cranial nerve 10 is intact. So next, can you move your face against resistance? Okay, and shoulders. All right. So that means cranial nerve 11 is intact. I already did cranial nerve 12 with the tongue movements, up, down, side to side. Next,
Sorry.
Don't be sorry, nothing to worry about. Can I have you close your eyes and move your finger to your nose, alternating rapidly? All right, great. You can open your eyes. And her fine motor coordination is intact. She's able to rhythmically and smoothly, symmetrically alternate finger to nose. Can I have you put your hands on your knees and go like this? Great. All right. Rapid alternating movement is rhythmic and smooth. She's able to pronate and supinate her hands rapidly and alternatively. Next, can I have you turn your head all the way around? Bend side to side, and front to back. Okay, cervical range of motion is full. Can I have you lift your arms out and put them back? Can you put them in front of you? And down, back. All right. Are you able to rotate? Okay. So she is able to flex, extend, abduct, adduct, and rotate her shoulders. Can you do this? And she is able to flex and extend her forearms, elbow joints. Any pain in any of these areas of your body right now?
No.
Okay. Can you lift your hands? Okay, and she can flex and extend her wrists. Can you move them in and out? Okay, and move your fingers outward and inward.
Oh.
And up and down. And thumbs. And she is able to oppose her thumbs. She has full range of motion in her upper extremities, fingers, wrists. Can I have you hold on to my fingers and try to pull away? Okay. She has great grip strength. Can I, okay. Next, can you put your arms out and try to flex against resistance? Okay. Now can you flex your arms? Try to extend. Okay. So upper extremities are 5 out of 5 muscle strength in the biceps, triceps. And can you, okay. 5 out of 5 muscle strength. I already checked her capillary refill. So I'm going to have you just put your legs out straight. And bend. And all right. Can you lift your foot up and down? Other side. And rotate your ankle. All right. And go ahead and stand up for me. Can I have you walk to the TV and back? All right. And bend over and touch your toes real quick. All right. And I was inspecting her spine for kyphosis or lordosis or scoliosis. And bend over one more time. All right. And her hips and her shoulders are at equal height. There's no abnormal curvatures of the spine. She was able to walk upright, unassisted, maintaining her own balance. Her gait was symmetric with opposing arm swings. All of her lower extremity range of motion is free. Can I have you, okay, and move
Squish
in.
your hands.
I was about to say that. All right, and I want you to flex or extend your leg. Okay, other one. Okay. And can I have you extend your foot? Or,
Sorry.
dorsiflex and plantar flex. Great. And move your toes up and down. Okay. And side to side. So upper and lower extremities have full range of motion, plus or 5 out of 5 muscle strength bilaterally, and there was no signs of any swelling, tenderness. It looks like hair is evenly distributed. There's no bald patches or
They're not that air.
well, if there were bald patches down here, we would wonder about your circulation.
Oh, okay.
So, all right, and go ahead and put your feet down. Okay, and dorsalis pedis is +2, full bilaterally. No edema noted. Her capillary refill is brisk. Lower extremity stuff. I do need to test your patellar reflex. Is that okay?
Yeah.
All right. So usually you would use a reflex hammer, but I don't currently have one, so I'm just going to let your foot dangle. And there's a +2 response. That is the normal expected response. All right, and same with the left leg. Wonderful. So I need to ask you, have you had a bowel movement today?
Yeah.
Okay. What's your normal pattern for?
Just usually one after breakfast, and then, yeah.
Okay.
If I have too much dairy, then I sometimes go twice.
Okay, all right. So I will take note of that. Can I have you lay down on your back?
Yeah.
And bend your knees. Then I'm going to inspect your abdomen. All right, and I am going to look this side. All right, and I don't notice any visible pulsations. It's pretty smooth. I do note some striae and previous belly button piercing. I'm going to go ahead and listen to your bowel sounds. All right, great. So normal active bowel sounds in all quadrants and no visible pulsations. Your stomach is fairly smooth, slightly convex. Alright. Thank you. So, is there anything else you wanted to bring up to your provider?
No.
No? Alright, well then I will go ahead and document that and tell your provider you're ready, okay?
Okay, thank you.
Thank you. Nice to meet you.
You too.